Welcome back to the ABCIQ Poets discussion on cannabis. Piss on everything. Tomorrow is Saturday. No topic is off limits. Tune in to abciq-.com where we discuss beaches, bags, and books, poets culture and what that means for us, literacy skill development, and we try and say it, don't spray it. However, we try and teach you and bring you bite-sized, digestible pieces of information to maximize time through technology. Whatever you choose to engage in, whether that be at 4:20 or 5 o'clock, do it responsibly. This is ABCIQ. Rock on. Welcome to ABCIQ. We're going to be having a poets discussion on cannabis culture, healers versus dealers, and the difference between recreational and medical marijuana in terms of using the plant as a healing agent. Our sources are coming from the Cannabis Pharmacy textbook. This is a practical guide for medical marijuana from Black Dog Publishers in New York, USA. This is a fantastic source of learning for us and for you to help you understand in small, bite-sized, digestible pieces of information to help you assimilate and understand knowledge. Let's begin with the cannabis history. The past, present, and let us take a look then what's going to happen possibly in the future. Cannabis is a multi-purpose plant. Let us begin there. It is a plant used in mind science, cognitive and behavioral science treatments. It is the cornerstone of alternative health treatments in Ayurveda. It is the cornerstone of natural and sustainable health treatments for mind science. So we here at ABCIQ, we utilize cannabis as a healing agent, although we are aware of the negative properties, as there is negative properties in anything. However, we do not focus our attention on the negative as much as we are aware and create solutions. So cannabis, medical marijuana, has existed longer than any other plant. So let's just clear the clutter for clarity and go right straight to the heart of the matter here. We are dealing with Mother Nature, and this is a natural plant. Cannabis has been grown for fiber, medicine, and inebriation for the last 12,000 years. Can you even find an abacus big enough to count the years that this plant has been around? So it has been around since the end of the last ice age. Cannabis can be grown both indoors and outdoors. There are no record deaths from cannabis use. I repeat, there are no recorded deaths from straight cannabis use. That's something to be very worthy of your attention. Discussing cannabis past, let's get out that abacus and go back 12,000 years and then hit the fast forward button to when we come into cannabis and when it became quite haram, which is Arabic for forbidden. In the 1940s, there was a number of conventions that were passed in the United States that impacted the rest of the world. But now we're looking at the international treaties. And the Single Convention on Narcotic Drugs of 1961 is something that stands in the way of worldwide legalization in terms of the health and looking at the medical sustainability. So the Single Convention of the Narcotics Drug of 1961, it prohibits the production and supply of prescribed classes of drugs, including cannabis, LSD, cocaine, and heroin. Well, I would not even classify cannabis in that family of LSD, cocaine, or heroin. Plant-based products, cannabis. Cannabis comes from a seed. I am not certain about LSD, cocaine, and heroin. I have no experience, nor do I want to have any kind of experience with these types of things. I'm a healer and a bit of a dealer at times. However, cannabis is my business. And so cannabis should not be classified in this category. The United Nations General Assembly Convention ratification on this is required. There is just this one act that needs to be focused on, and nowhere am I seeing these kinds of tangible supports being argued in the United Nations. So when it comes to climate change and the change of culture, I'd like to see the world start discussing peace processes and how we can create sustainable peace cultures in terms of green energy and healing cultures, as opposed to negative science that is currently being practiced and weapons of mass destruction, shall I say. This is a weapon of mass destruction in itself, in that it will destructively clean up communities and support in positive natural health and healing and wellness. So we should perhaps just change our perspective as to the books that you're reading and the experience that you have. My research has uncovered in a variety of places around the globe I have studied this plant, but one place in particular is in the Netherlands, in Amsterdam, and spending lots of time with the Cannabis College and looking at the tangible research that has been done on the impact of this plant and the patents that were filed from a variety of institutions in the Northern Hemisphere, patenting cures for cancer. Now, 75 seeds or strains have been patented. Which ones, I do not know. But this patent has been sold to North American organizations. And so when I look at holding natural cures, it is quite disturbing to me as an educator and a healer and a scientific researcher, and somebody who is passionate about this plant as it heals me, and I am almost certain that it will heal many, many others. So I hope that our world can come together now that we are standing on the other side of prohibition and take a look at these laws again, and because they are very, very dated. And as I mentioned, we can't find an abacus that is big enough to count all of the ways that we have been wrong on this plant. And so we do have to begin again at ground zero, and this plant has the capabilities to heal many, many, many naturally. So let's go back to healing versus dealing, use or abuse. From 1500 to 200 BCE, cannabis was used as a medicine in the Mediterranean regions, in Egypt and Greece and India. In ancient Persia, which is now modern-day Iraq, cannabis was ranked as the most important of all medicinal plants. Persian physician Muhammad, and pardon me with my enunciation and pronunciation, as Zakaria Yirazi, from 865 to 925, he practiced Islamic medicine, and he both wrote some research on how it was used as a medicine, and this was portrayed and interpreted both negatively and positively. And so there was some contradiction in terms of that interpretation, and so it never really went to the public for as much as it stayed behind the closed door. In 1809 to 89, Sir William Brooke O'Shaughnessy, he was an Irish physician in Calcutta, India, who studied the medicinal use of cannabis and examined it on cholera, tetanus, and rheumatism. Per a recent survey by the International Association for Cannabinoid Medicines, most individuals who use cannabis for medical reasons are seeking symptomatic relief from pain or physical discomfort. For pain, injury, accidents, migraines, sleep disorders, depression, neuropathy, cancer, multiple sclerosis, seizure disorder, depression, spasms, spasticity, chronic pain, obsessive compulsive disorder, rheumatoid arthritis, and post-traumatic stress disorder. Cannabis is a very complex plant. How does it work? There is numerous studies that have shown that the range of effects occur when cannabis medicines are administered to different patients. The variance depends on several factors: cannabis use, the patterns of use, genetic variations, and how it is administered. So we can take it orally, we can smoke it, we can eat it, we can take it as a patch, we can take it as a spray in pill form, and how it impacts the human body is very, very different depending on your relationship with it. So best known cannabis compounds are the phytocannabinoid, cannabinol, pardon me, or let's just shorten that, THC. We all have to improve our literacy skills. Supercalifragilisticexpialidocious, spell that one. THC and CBD, cannabis compounds in herbal cannabis or whole plant extractions, tend to work together in synergy, delivering what is frequently referred to as an entourage effect. The variation in medicinal effectiveness associated with different cannabis cultivators is due to varying ratios of active compounds produced in these cultivars. Now, the body absorbs 50 hours after ingestion. THC and its psychoactive metabolite will typically be eliminated from the bloodstream. THC's non-psychoactive metabolites can hang around for weeks in very heavy users. All right, different varieties produce different effects. And so now we talk about strain-specific cannabis. There is cannabis sativa and cannabis indica, but there is a variety of ways of how this is, as I mentioned, ingested and prescribed. So cannabis sativa, if you understand this plant and if you have seen the leaves on it, you can tell if it is a sativa or an indica or a hybrid plant. So cannabis sativa is stimulating, mood elevating, and it's proper for most daytime use. Cannabis indica, body high, relaxing, stoning, sedative, more potent, and for night use. Sativas are more than just fiber and rope. They carry the gene to make the enzyme that converts CBG to CBD rather than to THC. So CBD and hashish cultivators of the Middle East, Indica sativa, crosses containing CBD and THC, Kush varieties, originating in the Afghanistan and Pakistan areas. These are coastal plants, and this is the plant that is very, very good for people like me who suffer from neuropathy, and it is it provides the nerve for vitamin B patients for stimulation. At least it's happened this way in my body. Whether that will happen in your body, you have to speak to your doctor about this, but I am just speaking of my own personal results as a patient and a researcher and somebody who is a prescribed medical user and somebody who is passionate about the science of this plant, who is educating you. So medicinally, cannabis is cultivated from Vietnam to Lebanon, from Egypt to Africa, Argentina to Colombia, from Panama to Russia. So understanding now, if we can go from weaning people off opium and opiates and to something that's a little bit more healthier and natural for the body, this does not create the side effects as other drugs do. This is a much more pleasant form of treatment for long-term kind of treatments and for more natural treatments. Welcome back to the ABC IQ Poets discussion on cannabis. We're looking at cannabis as a healing agent, discussing healers versus dealers, and our experience with the science of this cannabis plant. So as a plant medicine, cannabis can be eaten, smoked, vaporized, and applied as a topical treatment, taken sublingually and used as a suppository or pharmaceutical pastille. So smoked or oral and or as an oil in from the plant that is extracted. It is used to treat a variety of things as acne, Alzheimer's disease, arthritis, asthma, autism spectrum disorders, depression, diabetes, fibromyalgia, glaucoma, insomnia, Parkinson's disease, pain, multiple sclerosis, menopause, adolescence, anxiety disorder, attention deficit hyperactivity disorder, autoimmune disorder, cancer, neuropathy, palliative care, post traumatic stress disorder, seizure disorder, pain management, sports medicine, stress, and a variety of issues in women and men's health. So, the science of this plant cannot be denied or cannot be ignored. However, there is so many different mitigating factors as to how we can tabulate big data and a secure blockchain technology in terms of how can we look at the positive impact on this plant when it heals so many, and it's processed in so many different ways. This is the juxtaposition here in 2019 as we are on the other side of prohibition, bringing the big abacus forward 12 million years since the Ice Age. And so we need to educate sustainably and professionally. How can we do this and support long-term natural health? We must look at this as, first of all, as a healing agent and absolve the negative science around this and really start discussing some positive, sustainable ways. Even in the media, we're not seeing any kind of positive attention to this, although I'm not advocating for everybody to go and hang out on the hillside with a big massive bong. I'm just saying that this is something that you need to experience with for your own body. When you first ingest it, it is going to have different impact as if you are a long-term user and your body becomes used to it like anything. So the first time that I experienced and developed my relationship with this plant, I was 15. However, when I bought my first support system, it was in 1998. And so then I started to grow as a patient, and I also grew for myself to understand why my body loved it so when I have been diagnosed with things like neuropathy and having lots of trauma and body trauma from breaking my body in an all-terrain vehicle accident to having a massive broken heart. And so understanding life, and everybody has a series of issues that happens to them at one time or another, but our resiliency and how we process all of that through the science of our own mind. This is where cannabis has healed me, and I hope that it will heal you and heal others. Cannabis, medical marijuana, healing versus dealing. This is an ABCIQ Poets discussion, and we are discussing cannabis and the science of the cannabis plant. We cannot deny the positives of the plant as a healing agent. We have come a long way from the Cheech and Chong days, although we love Cheech Marin. If you have any familiar with this movie, and it really formulated cannabis culture and what Tommy Chong and what cannabis did in the mainstream. Although he is a very strong positive advocate for the science of this plant, as he has used both recreationally and medicinally. And so these people who have been positive agents, and although I poke a little fun at him, but this is him in the mainstream media and smoking big gaggers, which kind of scared a few people off who didn't understand that. Although you have not lived until you have hotboxed. And remember, I'm not entirely innocent in all of this. We've all had a past, and I said I'm a healer and was not a bit of a dealer in terms of I am a mad scientist trying and experimenting these things on myself first, because words don't teach and life experience does. So I am not full of shit, although some people would say she's so full of shit, her eyes are brown, but that is not the case. Not with this plant, anyway. I just believe that an uninformed public is a very ignorant public. But words don't teach, life experience does. And so until you have walked a mile in somebody else's shoes and perhaps turned the page and had some different life experience, you would never know. So I am here to teach you, and I'm here to inform you and educate you. And whatever it is that you choose to do with this information, that is completely up to you. Research has demonstrated that cannabis and medical marijuana have provided safe and natural cures, supporting the body to sustain and heal naturally. Safer, more cost-effective forms of treatment for supporting cancer, neuropathies, pain management, anxiety, and seizure disorders. Cannabis medical marijuana is the cornerstone, as I mentioned at the beginning of this presentation, of cognitive science, mind science, cognitive behavioral therapies, and it is the cornerstone of Ayurveda. It is the cornerstone of a third, I believe, of the Canadian population in terms of what people might choose to reach for self-medication. So this plant and its complexities as a healing agent and as a recreational agent, whatever it is that you choose to engage in, whether that be at 4:20 or 5 o'clock, I'm just asking you to do it responsibly. Piss on everything. Tomorrow is Saturday. That's what it means to be a poet. We need to spit it out, kick it out, shit it out, but just not on our neighbor. Welcome back to the ABCIQ Poets discussion on cannabis. Piss on everything. Tomorrow is Saturday. No topic is off limits. Tune in to abciq-.com, where we discuss beaches, bags, and books, poets culture and what that means for us, literacy skill development, and we try and say it, don't spray it. However, we try and teach you and bring you bite-sized, digestible pieces of information to maximize time through technology. Whatever you choose to engage in, whether that be at 4:20 or 5 o'clock, do it responsibly. This is ABCIQ. Rock on.